a common hidden cause of dizziness. Hi, my name is Doug. I've been a physical therapist for 30 years, and I specialize in helping people with balance problems learn to walk again. In this video, I'm going to talk about a very common problem, dizziness. So many people have dizziness or vertigo. They complain about it, they come to their doctors about it, they see their physical therapist about it. I've learned that this is one of the most often misunderstood problems that affect a wide range of people. It's not just seniors. It's also young people who've had concussions and head injuries. It's people that have diseases such as Parkinson's or who've had strokes. Dizziness and vertigo are just very common problems, and they're leading causes of falls. So it's really worth learning a little bit more about the differences in the different causes of dizziness. Now, one way a doctor or a physical therapist can differentiate dizziness is we use terms such as central versus peripheral. Basically, if someone has vertigo or dizziness and it comes from a peripheral origin, that means that it originates basically from the organ in the inner ear that's responsible for telling your brain whether or not you're moving, accelerating, or moving against gravity. That organ, which is in the middle of our ear, can go wrong a number of different ways. It can be affected by an infection or some type of tumor or disease. But more often than not, there's stone crystals that are actually in that organ, normally that tell us when we're going kind of up or down an elevator, up and down in a plane, because they move against gravity, and there's a little organ in there with hair cells that tell us we're moving against gravity when those rocks move. But sometimes those rocks actually move into the wrong part of the inner ear, and they cause us to have positional vertigo or benign positional vertigo. And that's something a lot of times a physical therapist can help you correct, because there's exercises such as Epley's maneuver that can get rid of it. But what I have learned is that the majority of the public and a lot of doctors and even a lot of physical therapists often believe that this is the main cause of dizziness, is something wrong with the inner ear. There was an interesting study that I read, and they looked at emergency room visits where someone came in with a complaint of either vertigo or severe dizziness. And what they found was that of these people, 98% of the time, the emergency room doctor diagnosed it as benign positional vertigo, basically an inner ear problem. But that when they looked at the records of the patient afterwards, so they followed up with all these patients, and it was actually a big study. It was done on 20,000 patients, all of whom were over the age of 65, that came into the ER with a complaint of dizziness or vertigo. What they found was that 80% of the time in that population of people over 65, that it was a cardiac event that was causing the dizziness. And that's kind of a real surprise to a lot of people, to the public, but also to a lot of doctors and physical therapists. And I've seen this study repeated. I've seen different versions of it done around the world. And it seems to be a big problem in that the medical community and the public often believe that when you're having dizziness, there must be something wrong with the inner ear. Let me just name some things that can cause vertigo. So one is a crystal being in the wrong part of the inner ear. It definitely causes vertigo. But so can taking too much medication. So can drinking alcohol or taking drugs. Those can also cause vertigo. It can also happen when you're having a stroke. Anything that denies oxygen to the brain, or if there's any type of bleeding in the brain, you can have vertigo where your eyes are doing something called nystagmus, where they're moving kind of violently in one direction or in several directions at once. And that causes that sensation that the room is spinning, and we call that vertigo. But that also can cause something called dizziness. So dizziness is sort of the big category that includes vertigo, but dizziness just also includes anyone with a feeling that they're off balance. Anytime that dizziness originates from the inner ear, we call that peripheral. When it originates from the brain or the central nervous system, we call that vertigo of essential origin. Now, I have a test called the VNG, and a lot of other people do similar type of testing. And what they find is a lot of times, someone that comes in with vertigo tests positive for both peripheral and central vertigo at the same time. How could that be? Well, it's possible that someone has vertigo that's originating from just their brain not processing their balance correctly. That's central vertigo. But at the same time, they may have something wrong with their inner ear. Most often, it's a crystal in the wrong place. You can have both things at the same time. How can that be? It's because vertigo is a symptom. It's a symptom just like having a cough is a symptom. You can have a cough because you have an allergy, because you have a cold, because you have COVID. You could be a number of things that cause someone to cough. It doesn't mean that all coughs originate because someone has a cold. The same is true for vertigo. Vertigo is really a symptom. And I've seen lists with more than 100 separate things that can cause vertigo, some of which I just listed for you. But when someone has vertigo, it's not automatically the inner ear. Now, I'm not trying to say that it's only the inner ear 20% of the time, but there are studies that have shown that when people go into the emergency room complaining of vertigo, that 80% of the time, it's actually a cerebrovascular event, a stroke, that's causing the vertigo and not a crystal out of place in the inner ear. But how is that person treated? They're treated for the crystal problem. And more often than not, they don't get better because the vertigo is not coming from the inner ear. So when vertigo comes from a central origin, why would that happen? Basically, our brain gets information from our environment in a number of different ways. And then the brain processes that information and it tells the brain, I'm balanced. So you get information from your eyes, from your inner ear, from your cerebellum, from your fingers, from mechanoreceptors in your joint. You get information from even the ground underneath your feet. And your brain, your miraculous brain, can take all that information and pull it all together without you knowing it and then tell you, I'm balanced. So if I put someone in a pitch black room, deny them any kind of vision, the person knows where they are in space. If there's nothing wrong with them, they know where their body is. They have a sense of where their body is in space and that they're upright and that they're not moving. They know that. They don't become disoriented. They don't feel that they're falling. Even turning the lights out, it doesn't make most people that are not having any problems feel off balance. But someone who has a problem with their central nervous system in the balance regions, when they go in a dark room or they don't have vision, which they're probably relying on a lot to tell them where they are, they feel that they're about to fall. In fact, a lot of people that have central vertigo, what I notice is when they change their focus, so when they focus on the ground right in front of them, they're fine. But the minute something distracts them, like a person or a dog off to one side or just something, they look in that direction and suddenly they feel a sense of being disoriented. That disequilibrium is really a type of central vertigo. In some cases, that can be so severe that they feel they're moving all the time. I've had patients with strokes and Parkinson's disease. They feel that they're literally living on the open ocean. They feel the ground is moving and the room is moving all the time. But they don't have anything wrong with their inner ear. They have a problem processing it in their brain. They have damage to their brain that prevents them from accurately processing all that information from our environment to tell them exactly where they are. So they always feel that they're at motion. But even someone with a concussion or post-concussion syndrome, or even a TIA or a very, very, very minuscule minor stroke that many doctors would say, that shouldn't affect you, they experience dizziness for the rest of their lives. And some people call it persistent vertigo or persistent dizziness. They experience a sensation that they're off balance all the time, and that's called central vertigo. So before I go, I want to just talk a little bit about how you treat both peripheral and central vertigo. Peripheral vertigo is very widely understood, and it's most often what people think is wrong when you say you're having a balance problem. And because of that, there's a lot of treatments for it. If you go on the internet, you can see, Epley's maneuver, barbecue roll. There's all these different things you can do to help reposition those crystals if the crystals are off. There's also surgeries and medication to treat the inner ear if you're having an infection. Maybe you have Meniere's disease or you have an acoustic tumor. There really are a lot of treatments for that can help. Although sometimes if it's an inner ear disorder, nothing helps, and then they oftentimes get sent to physical therapy because the doctor doesn't know what else to do, and then we're supposed to do vestibular exercises to help them just get used to the feeling of being dizzy all the time. But a lot of times what I've seen is the problem is not just peripheral vertigo, but in fact it's central vertigo because the person had a history of strokes. They had a head injury recently, or maybe they had several head injuries 10 years ago, and now they have post-concussion syndrome that's suddenly causing them to be dizzy. These things do happen, and they're well documented, but the public and even the medical community may not really be, that might not be the first thought in their mind that, oh wow, this could be central vertigo. So can central vertigo be treated? Yes. I've been doing this for a long time. I wouldn't say, I've been practicing for 32 years, but I haven't really effectively been treating central vertigo for that long. But I have been doing this for about the last 8 years. And what I saw in the research is you can improve central vertigo. There are a number of treatments that can help. One of the things is the terminology. A lot of times doctors don't call it central vertigo. They call it a loss of whole body proprioception. And that's just a fancy way of saying that when you close your eyes, you can't tell where you are in space. You feel you're in motion. Even when your eyes are open, you might feel like you're in motion. So that sense that you're moving or that the room is moving all the time, that's kind of different than vertigo from the inner ear. That's really a loss of whole body proprioception or awareness of really where the body is in space. So how can that be treated? Well, there's studies that show that balance challenging activities, things that challenge your balance, can make it better. They don't just make you get used to the problem. They can actually help you develop regions of the brain that can now know where you are in space, and that can get better and better. I'm going to give you 2 examples of this just to kind of prove my point logically. The first is a baby. When a baby first starts to walk, they don't really have very good whole body proprioception. In fact, they exhibit a lot of the symptoms that I see in my stroke and head injury patients when they first start to walk. They're trembling, they're very stiff, they miss their targets all the time, and when they're moving around, if they change focus, they fall right over. What is that? That's a loss of whole body proprioception. Actually, it's not a loss, it's them not having it. How do they gain it? A baby does a lot of balance challenging activities. Toddlers move around in their environment. They stand on one leg, they play games, they fall down a lot. But over time, they develop a better and better sense of where they are in space. And that continues through our life. If you are a couch potato and you're not really active, you probably don't have as good whole body proprioception as, say, an Olympic gymnast or a professional basketball or football player. People that do sports all the time are always developing their whole body proprioception. Their awareness of where their body is in space is just better than yours. It's better than mine because I don't play professional sports and I'm kind of a klutz. But that's the thing. You can improve this. This is not an innate skill. This is something that can get better over time. So by you practicing balance challenging activities, whether you're 2 years old or 85 years old or 90 years old, it can improve your whole body proprioception and your balance and your coordination. And that's the thing, is that we now know that doing balance challenging activities does improve proprioception, especially whole body proprioception and balance. But there are also exercises you can do. You can do things that therapists call gaze stabilization exercises. These might mean holding a card up and looking at a card and then moving your head but keeping your eyes focused on the card, or having someone move something in front of you and you following it and practicing that over and over. Over time, that actually can get better, so it doesn't make you as dizzy. What I've learned, though, is that a lot of times these exercises aren't hard enough. A lot of times when it comes to balance training and vestibular training, the research shows that the harder the exercise is, or the harder the challenge is, the more the effect, the more that balance improves. So when it comes to vestibular training, I've actually developed my own exercises that go beyond the typical exercise and have the person standing while they're doing gaze stabilization exercises. The point is, you can improve this problem. Even if you have a really high level of proprioceptive loss, you can gain it back again with the right exercises. Now, on my channel, I do have a number of exercises that I say these are for dizziness or for vertigo. If you watch those exercise routines, you can use that to help yourself regain this skill. But I really recommend that you go see a doctor first and get it properly diagnosed, because a lot of things can cause vertigo. As we talked in the beginning, it can be peripheral, it can be central, and a lot of people, the doctor needs to do a little bit of testing to try to determine which problem it is to then tell you what to do. Because what I see is a lot of times people actually have central vertigo, but they're treating it like it's peripheral vertigo and they're not getting any better. So obviously this is a topic that could be a very long discussion, much longer than I'm going to do here. But if you have any questions, you're welcome to write comments in this video and I'll try my best to answer them. I do have a number of videos on my channel that show you how to do both balance challenging activities and things that can improve your whole body proprioception, and I think that can help the vast majority of people. But I definitely think if you're having a problem, you should go talk to your doctor and see what they think is the cause of your dizziness and what would be a good way of treating it. To do the standing dizziness exercise, you'll need a couple things. You want to have 2 chairs, one on either side of you, and then a sturdy chair behind you just in case you lose your balance and need to sit down. The other thing is you need something on the ground to look at, because you want to be able to look at something on the ground and focus on it, look at something straight in front of you and focus on it, and then look at something on the ceiling. So usually people have something on the ceiling they can look at and something out in front of them, but a lot of times on the ground there's nothing specific to look at. I like to use something like a piece of blue tape or an object like a ball. Now, to do this activity, what you're going to do is you want to try to stand, if possible, in the heel to toe position. That means putting your right leg in front of your left and your toe is touching your heel. Now, for a lot of people, that might be too difficult, and it's fine if you want to spread your legs apart. You can even stand with your legs side by side if you find that that's the only way you can stand without holding on. Because to do this exercise, you can't be holding on to anything. You have to let go of everything. Now, the directions are this. In this position, you want to let go of everything and then look down at the object on the floor. Keep looking at it for 2 seconds. Then look straight ahead, focusing on something for 2 seconds, and then slowly look up and focus on that for 2 seconds. Now, anytime you feel dizziness or disequilibrium, you want to keep looking in that direction until it goes away. Now, sometimes it'll go away in 3 or 4 seconds. Some people, it can be as long as 30 seconds for it to go away. The way this exercise helps you is by repeatedly practicing making that dizziness go away. That's how over time you'll improve and stop having this type of dizziness. But in the beginning, you might find that it's just overwhelming when you shift your head. Some people, when they look straight ahead, they're fine, and then when they look up, they're overwhelmingly dizzy and they have to grab onto the chair. Now, anytime you grab onto the chair, you want to switch legs. So if you're starting with your right leg forward and you lose your balance, you then want to grab the chair. Once the dizziness gets better, you want to switch legs. It's very important to never do this exercise if you're feeling overwhelmingly dizzy. If you're actually having vertigo or you feel that you can't stand anymore, you've done it too much. In a lot of people, this exercise can be made harder or easier by 2 things: where you place your feet and how fast you move your head. If you move your head fast, that's definitely going to make you more dizzy than if you do it slowly. So in some people, I just have to tell them to keep slowing down their head speed, because the object of this is not to make yourself dizzy. What you want to do is basically do it so that you experience that sensation of feeling disoriented, but only to a mild level. And then you want to keep looking in that direction until you can calm it down over and over again. Mild is the name of the game. You don't want to give yourself severe dizziness because it's just not going to get better. What you want to do is repeatedly practice changing your focus, feeling a little bit dizzy, and then calming it down by keep staring in that direction. And that's how people get better from this problem. So to do this exercise effectively, you want to do this for 5 minutes at a time. That means setting a timer, getting your chairs in place, and starting the timer by letting go of the chairs. And then do this for about 5 minutes. I find that this works best if you repeat it 5 times a day. So for 5 minutes, 5 times a day is the fastest way to improve this problem. But a lot of people don't have that much time, or they don't feel comfortable doing it that much. And I've seen people improve with this, doing it as little as twice a day. But you do have to do this every day for a few weeks to see this kind of improvement. I've worked with thousands of clients, and I've seen them with central vertigo get rid of it and not have this problem anymore. But it takes doing it about 5 times a day for a few weeks before you see that difference. Video helpful. Click the subscribe button if you want to see more videos like this. Here's a new course that can help anyone regain their balance. This program includes 30 different workouts, 1 a day for 30 days, that will help anyone who has problems with their walking, their balance, and their stability not only improve their balance and their strength, but improve their walking.